This is a tutorial to teach you how to help with and hopefully eliminate a pinching joint in your neck. If you have a pinching joint in your neck, it is obviously going to be painful, but it will also greatly limit your range of motion, which is going to be a problem. When we find pinches in neck joints, they're almost always when the neck rotates and then tilts the ear back out over the shoulder. Imagine if I had water in my ear and I was trying to dump it out this way. We're going to find that the joint pinches on that closing angle side. In the functional range system, we call that a closing angle joint pinch or a closing angle joint pain, and they are certainly a problem when they happen in your neck. So what we're going to use is an exercise from functional range conditioning called PAILs. PAILs stands for Progressive Angular Isometric Loading, and in the functional range conditioning system, we use PAILs to help create length of tissue and space within a joint. So what we're going to try to do is create some space in the joint that's pinching when we angle back this way. So what I'm going to do is turn my head to the side and just start to explore where I start to feel the pinch. So say I tilt back and it's right there that I feel the pinch. That's where I'm going to stop. I'm not going to go any further back into the pinch because it's going to hurt and inflame tissue. When we do a PAILs contraction, what we're going to be doing is blocking the opposite side of the head and skull so that we can do an isometric contraction of the muscles opposite the side of the joint. So I'm going to block the side of my head and try to tilt out away from the neck pinch. So again, I'm going to turn my head to the side, tilt back right to where I feel the pinch, and then block that with my hand. I've got a good firm hold on the side of my head, and I'm going to start to try to tilt my head back this way, but I need my hand to block this position. So I'm going to press my hand into the side of my head and my face, and I'm going to do a PAILs contraction, trying to tilt my head out away from the pinch. And I'm going to do this at a minimal level of effort to start, let's say 20% intensity or effort of contraction for 10 seconds. I'm going to go for 3, 2, 1, and then I relax. I'm going to stay in this position, and I'm going to up the level of contraction through the next PAILs. So I'm going to take a little breath in. I'm going to keep my core tight. Now I'm going to try to tilt and push my head harder out of that position. Again, angling away from where the pinch is. Now I'm going at 40 to 50% effort of contraction, contracting all the muscles on the opposite side of where the pinch is. For 3, 2, 1. After I do those first 2 PAILs contractions, I'm going to start to explore and see if there's less pinch as I go back to that side. And if there is less pinch, I'm now going to stay at that angle, and I'm going to reblock my head at that new angle where there's less pinch. From here, I'm going to reapply the PAILs, again, trying to tilt my ear out of there, contracting all those muscles on the front and side of the neck opposite of where the closing angle joint pinch is. So these are done for 10 seconds, and I'd like to up the level of contraction and intensity or effort as I go through my PAILs. And then I relax, and again, I re-explore. Can I get further back into that direction with less pinching? And if so, I'm going to keep doing PAILs until I can't bend any further back. You'll find an end range of motion where your head just won't be able to go any further, in which case you've now opened up some joint space where it was pinching. Now, what is pinching is the joint itself, so that as I bend back this way, instead of the joint closing the angle nicely like this, it's bunching in upon itself and pinching. There's a lot of sensory nerves in those joint tissues that get really painful if they get pinched upon, and then they get inflamed, and we've got a big problem on our hands. So what we're doing with a PAILs contraction is taking where that joint is pinching and binding, and when we apply a PAILs, we're kind of bowing it out like this, trying to create some space within that joint so that when we bend back into that range, instead of it pinching, it closes down nice upon itself like that. So after you do each PAILs, you go back and you kind of re-explore that range to see, is there less pinch? And if so, your job is done for the day. However, if that pinch reappears later in your day, you might need to reapply this a few times, a few days in a row, to move that pinch on out of there for good. But I found this to be very effective in my clinical practice, where I use my hands to help guide people into these positions. And I teach it to patients that have those closing angle joint pinches so that they can use it throughout their day and on a day-to-day basis. So that's a quick tutorial of how to help you out and get you out of a closing angle joint pinch in your neck. And I sure hope that you find it helpful.